What is NPO and why can't we let our patients eat sometimes? NPO stands for nil per os, or nothing by mouth. And it means literally that patients cannot be intaking anything by mouth. There are a few reasons why patients may be NPO, so let's talk about them. First and foremost, the most common one is your patient may be going to a procedure or surgery. The reason why we don't want patients to have anything to intake prior to procedures or surgeries is because we want their stomach empty. A lot of times patients are laying flat or in other positions when they are getting procedures done. They are also getting sedation medications or different medications that can make patients more nauseous. They may be getting a breathing tube or something done in their mouth that can trigger their gag reflex. You may think, well, why does that really matter? I'm going to be sleeping. Why do I care if something comes out of my stomach? Well, you should care, because if it comes out of your stomach, the first place it's going to go down is into your lungs. So when you have a planned scheduled surgery, always best to follow the NPO recommendations that is recommended by your provider. Another reason a patient may be NPO is because of some sort of condition that they have. Maybe they need to be on strict bowel rest because they have some sort of issue going on in their abdomen. Maybe a patient just got a procedure on their esophagus or somewhere in their stomach, and they can't have anything in their stomach because it can worsen whatever procedure was just done. Another reason you may be NPO is because your patient is having difficulty swallowing. Sometimes this is a temporary thing, like if a patient just got a breathing tube out, there might be some swelling in there. Depending on how long the breathing tube is in, patients can have more difficulty swallowing afterwards. Or sometimes patients just start to have swallowing conditions as time goes on, as they age, or maybe because they have something else going on that is causing them to have the swallowing issues, like a stroke. When things go down into the patient's lungs, this causes an aspiration pneumonia, and this can be, quite frankly, deadly in a lot of patients, especially if they're already super sick and have a lot of underlying health issues, and then they aspirate and it goes down into their lungs, and now they have this raging infection. Not good. So while yes, sometimes I know patients get very frustrated when we say you can't have anything to eat or drink for X amount of time, or until this procedure, or until you get evaluated by speech, or whatever it may be, we have good intentions, I promise, and it's just to help prevent you from getting sicker.